Hello my fellow teammates and all the audience that I appreciate who will watch this presentation. On this blissful occasion, we from the small group discussion, but the group would like to present our student project entitled Universal Newborn Hearing Screening. But before moving forward to the next plan, let me introduce all members of this group which is shown in this slide. Next. We will present our student project with three main chapters which are Introduction, Literature Review, and Conclusion. For the first speaker, time is yours.
Thank you for the time. My name is Yuda, and I would like to explain about the background of the student project. The definition of hearing loss is the ear is unable to convert the mechanical energy of sound vibrations into the electrical energy of nerve impulses. The etiology of hearing loss can be classified into two broad categories, congenital and acquired. The prevalence of hearing loss has significant variability based on available statistics. The impact of permanent hearing loss in childhood has long-term effects for both children and their families. Hearing screening programs are available for this common issue in the majority of developed nations. The purpose of this student project is to provide insight into the prevalence of hearing loss and effectiveness of hearing screening. The problem formulation of the student projects are: what is the definition and epidemiology of newborn hearing loss? What are the risk factors of newborn and children hearing loss? What is the etiology of newborn hearing loss? How is the importance of universal newborn hearing screening? What are the types of universal newborn hearing screening? How are the effectiveness of universal newborn hearing screening? And what are the disadvantages of universal newborn hearing screening? That's all from me. For the next speakers, the time is yours.
Thank you for your time. My name is Nathanael Farrel with 077 as my three last digit numbers. There are 7 objectives to this literature. First, to give definition and epidemiology of newborn hearing loss, to give information about the risk factors for newborn and children hearing loss, to inform the etiology of newborn hearing loss, to explain about the importance of universal newborn hearing screening, to give information about the types of universal newborn hearing screening, to explain about the effectiveness of universal newborn hearing screening, and lastly, to give information about the disadvantage of universal newborn hearing screening. The purpose of this literature is to present the proper information about hearing loss and the checking process through universal newborn hearing screening. This literature explains about definition, epidemiology, etiology, risk factor of hearing loss, and importance, type, effectiveness, and disadvantage of universal newborn hearing screening. We sincerely hope that this literature will give a great insight about hearing loss and hearing screening in order to enhance the knowledge of society and healthcare association regarding this matter. Next will be continued by my colleague.
Okay, my name is Kesawa Partha. The last digits of my name is 00. Okay, I will explain about the description. Newborn hearing loss or congenital hearing loss is a common chronic condition that affects neonates worldwide. Environmental factors are the biggest contributor in developing countries, while genetic factors are the biggest contributor in developed countries. According to a study, 4.36 out of 1,000 newborns experience hearing loss. Prenatal exposure to torch infection is one of the biggest risk factors, especially in developing countries. Sub-Saharan Africa and South Asia have a prevalence of 19 until 24 incidents per 1,000 newborn, whereas in developed countries, the prevalence is significantly low, at 1 until 2 incidents per 1,000 newborn. Congenital hearing loss has a significant impact on child development. Early detection and appropriate intervention within the first 6 months significantly reduce the adverse effect and improve language acquisition in children. That's all from me. The next will be explained by my friends. Thank you.
Okay, my name is Sara Putri Bungaran with 078 as the last 3 digits of my student number, and this time I would like to explain about risk factors for newborn and children hearing loss. Some of the risk factors that cause delayed onset hearing loss are congenital stomegalovirus, syphilis, rubella, congenital herpes, and toxoplasmosis. And hospitalization in the neonatal intensive care unit, assisted ventilation, ototoxic drugs, and extracorporeal membrane oxygenation therapy are some aspects of treatment that have been found to be risk factors with a very low level of evidence of newborn hearing loss. Another risk factors include hyperbilirubinemia, meningitis, and history of hearing loss in the family. The research showed that a child was 1.92 times more likely to develop postnatal hearing loss if they had a family history of hearing loss than a child without a family history of hearing loss. Family history also plays a big role in showing the relationship between congenital hearing loss and delayed hearing loss. And essentially, the more risk factors a child has, the more likely they are to develop hearing loss. And maybe that's all for me. Thanks for your attention. And for the next speakers, time is yours.
Thank you for the opportunity. My name is Putu Chandrika Dewi with the last 3-digit name series 71. So here I will present about the etiology of congenital hearing loss. There are two etiologies of congenital hearing loss, the genetic and the acquired one. The first is genetic congenital hearing loss, which most frequently results from a single gene abnormality. There are syndromic hearing loss when a co-inherited physical or laboratory abnormalities are present. There are autosomal dominant syndromic hearing loss, such as Waardenburg syndrome, bronchiotorhinal syndrome, and Tricher-Collins syndrome. And then the autosomal recessive syndromic hearing loss, such as Usher syndrome, Panzer syndrome, and Terval and Large-Nielsen syndrome. On the other hand, there is a non-syndromic hearing loss when co-inherited physical or laboratory abnormalities are not present. There are autosomal dominant non-syndromic hearing loss if there is the presence of AT and HAL genes like TACTO, WFS1, KCNQ4, TOTH, GGB2, and MY01A. And then the autosomal recessive non-syndromic hearing loss when the GGB2 gene mutation happen. X-linked non-syndromic hearing loss if there is the presence of PO class 3 transcription factor 4, phosphoboribosylpyrophosphate pyrophosphate synthesis 1, and small muscle protein X-linked. And the last one is mitochondrial heritance if there is a A155G mutation in the mitochondrial 12S rRNA. Okay, that's all for my presentation. The next one will continue with for my colleague. Thank you.
Hello everyone, my name is Joanna with the last 3 digits of my student number 079. This time I will briefly explain about the etiologies of acquired congenital hearing loss. The first one is infectious causes. Toxoplasmosis, other infections, rubella, CMV, herpes virus, and syphilis or torches are organisms historically described as significant prenatal exposures that lead to congenital hearing loss. Other infectious diseases such as HIV, measles, Lyme disease, and other viruses are also associated with acquired hearing loss in infants. Next is neonatal meningitis. Neonates, especially preterm ones, have undeveloped immune systems, which puts them at greater risk for bacterial meningitis. They are also susceptible to particular bacterial and viral infections because of their exposure during the prepartum period. The third one is trauma. Many forms of hearing loss in newborns are secondary to trauma, such as head trauma, exposure to ototoxic medications, chemotherapy and radiation therapy, ECMO, iatrogenic injury due to surgery, and noise. And the last one is NICU infants. A stay in the INCU for infants more than 5 days or the presence of any of the following medical conditions such as ECMO, assisted breathing, ototoxic medication exposure, loop diuretics, and hyperbilirubinemia needing exchange transfusion are risk factors for persistent congenital hearing impairments. That is all from me. The next one will be continued by my colleague. Thank you.
I am Wulan with 3 last digit number 86 and I will deliver chapter 2.4, the importance of universal newborn hearing screening. Infants start learning to develop their language skills starting from their first day, which is their most needed period. Hearing loss is unnoticeable, which will lead to experiencing many difficulties in learning language, learning delays and speech development, and can be related to poor adaptive skill. So, UNHS is needed to discover early hearing loss and intervention for prevention of its impact on the ordinary evaluation and acquisition of language abilities. Also, faster diagnosis, knowing treatment they need, and preventing high-risk factors of hearing loss is expected. For the next speaker, floor is yours.
Hello, my name is Raharja Ariawan with 073 as the last 3 digits of my student number. This time I will explain about types of universal newborn hearing screening. The first one is autoacoustic emission or OAE. OAE are sound produced by the ear that can indicate healthy inner ear. There are two types. The first one is spontaneous autoacoustic emission, which is OAE produced by the ear without being stimulated. Even though SOAE indicates a healthy cochlea, the absence of SOAE doesn't necessarily indicate hearing abnormality. The second one is evoked autoacoustic emission, which is OAE produced by the ear upon being stimulated. There are three types of EOAE. The first one is transient evoked autoacoustic emission, which is evoked using tone burst or click stimuli. The second one is distortion product autoacoustic emission, which is mostly used in newborn hearing screening and generated by using two pure tone stimuli called F1 and F2. And the last one is stimulus frequency autoacoustic emission, which is an emission with the same frequency as the stimulus and evoked using single pure tone stimulus and has limited use clinically. That is all from me. The next one will be explained by my colleague. Thank you.
Hello everyone, my name is Natasha Putri with the last 2 digits of my student number 083. Now, I'll explain about one of the universal newborn hearing screening, auditory evoked potential or AEP. The evoked potential is electrical potential that develops in neurons responding to the activation of a sensory organ. The principle of AEP is measuring the integrity of neural response from a physical stimulus. The first step of AEP is stimulating the cochlear nerve with clicking sounds produced by headphone while infant is sleeping. Then, monitor how long the nerve is to respond with scalp electrodes. And last, determining if there's block on the neural pathway. There are 3 classifications and 7 peaks of AEP were found. Early onset, middle and long signal are captured for up to 10 milliseconds, then until 50 milliseconds and 80 until 800 milliseconds sequentially, while the peaks generated by particular anatomical structures, cochlea, cochlear nerve, Oliver complex, cochlear nucleus, brainstem, lateral lemniscus, medial geniculate, and auditory radiations are listed in order from 1 to 7. That's all from me. The following material will be brought by my friend. Thank you.
Hello everyone, my name is Gabriella Ferenina with 081 as last 3 digits of my student number. This time I'm going to explain about effectiveness of universal newborn hearing screening. Effectiveness of newborn hearing screening has already been demonstrated in various studies. Some studies have shown that it is the most effective method for identifying hearing loss before 6 months of age, which is really important for early intervention and treatment. Early identification and intervention can lead to better outcomes for language and speech development, socialization, and overall quality of life for children with hearing loss. UNHS works well in affluent countries, and prevention efforts are anticipated to have a greater positive impact in low-income nations. Thank you. That's all, and thank you.
Okay, thank you for your time. And now I will give a brief explanation about the disadvantages of universal newborn hearing screening. So, 2 major drawbacks are the frequency of false readings, with false positive rates ranging between 2.5 to 8%, and parental attitude, which can result in less patients present in the follow-up appointments. These problems can easily be avoided though by doing 2 tests to mitigate the false readings and proper education to parents given by their assigned physician. That's all from me. My partner will continue.
My name is Putu Sri Dianingsih and my last digit of my student ID is 070 and I'll continue the presentation. So, conclusion, newborn hearing loss is a common chronic condition affecting neonates. The rate of incidence in low and middle income countries are higher, while those in high income countries are lower. The risk factors are rubella, toxoplasmosis, family history of hearing loss, and others. There are 2 etiologies of congenital hearing loss which are genetic and acquired. Universal newborn hearing screening is needed to detect hearing loss in infants. It is important to diagnose infants with hearing loss and give them treatments. Hearing screening in infants can be done by autoacoustic emission and auditory evoked potential. Some studies have shown that newborn hearing screening is the most effective method to identify hearing loss before 6 months of age. Even though the newborn hearing screening is effective, it also has several disadvantages such as frequency of false reading and numbers of newborn loss in follow-up appointments. Next slide. Advice. Infants whose parents have history of congenital hearing loss and whose mother is infected with toxoplasmosis, rubella, and other infectious disease while pregnant need to do a hearing screening. If not treated, hearing loss can affect infant adaptation, language, and speech development. By doing the hearing screening, infants with congenital hearing loss can be given treatment immediately so that the hearing loss will not cause any developmental issues for the infants. That's all from me. Thank you.
Okay, and that's all from our presentation about our student project. We would like to apologize if there are any mistakes we made during these presentations. And thank you for your attention.